Hi, this is Damian Campbell from HGH Vallarta Clinic. I'm here with Dr. Roberto Gutierrez. He's an endocrinologist. Thanks for coming.
Thank you, Damian.
Yeah, so we work with a lot of child clients. He's the endocrinologist we work with. He can see the clients. He's seen many clients. We've been working together for 8 years. He's been doing this for how long? You been doing it for how long? You been an endocrinologist? 23 years more.
No, about 10 years.
About 10 years?
Yeah.
There's a lot of kids that we see that come in that have short stature, and he's kind of the expert when seeing them. We've been through this so many times that, when people come in to see us, what do they need? What are you looking for?
Well, the first thing that we look when a child is not growing is first to look if he's healthy, okay? Mm-hmm. Because, of course, the growth of the body is the reflection of the normal health. So in the first place, we have to look that he's completely healthy, that he's eating fine, that he's having a normal development. So, but it's supposed that his family physician already did that. So, and most of the patients, they've been seen by previously other doctors.
Correct.
But then after that, we have to look if part of the endocrine system is working fine. What means that? If any other of the hormones that are related in the growing process are being produced normally, like the thyroid, like prolactin, and of course, at the end, we look also for growth hormone. And also, depending on the age of the child, we look also for the sexual hormones to know in which stage of puberty they are. Because if they are too close to puberty, that is something that could affect the growing.
In what way?
In two ways. I mean, in the normal process of growing, puberty enhances the growing, triggers the growing. We have like a spur of growing just near puberty, just when puberty is starting.
So right when puberty starts, there's a growth spurt.
Yeah. Mm-hmm. But the problem is that if we are shorter, this spurt of puberty is going to give us something, but we were already short. So we are not going to reach what it was expected. Okay?
So once puberty kicks in, there's a growth spurt.
Yeah. In the other side, when we start producing all these sexual hormones, androgens and testosterone and estrogens, the growth plate is going to be closed. So we are not having too much time to keep growing anymore.
So how long does puberty last in boys, for example?
In boys, puberty takes a lot. It's supposed that comes like in 3 steps. Could start maybe around 8. It's like the first stage of puberty. That doesn't worry us too much because it's just like rehearsal of the body. It's just starting to produce some testosterone. And that is the moment then when the parents, they can notice that they start having some oily skin or maybe some smell on their armpits, and then it can stop there, and then they can have another stage maybe around 12 to 15. That's very variable in every population. But what we've seen lately is that every time this stage is in a younger age. So could be
so puberty starting younger.
Mm-hmm. Mm-hmm. So it could be around 12. Okay. The problem is that if this second stage, this clinical second stage that we can see, start younger, then it is going to be faster. Because this second stage is when we already see all the sexual characters changing. And that is going to give more maturity to the bones. And then the growing will stop.
So in the first stage, the growth plates are not really closing.
Yeah, no, they're not closed.
But when the second stage of puberty kicks in, that's when the growth plates start to close up.
Yeah. Once that we are in this second stage, they are going to start. The bones are going to start getting more mature, and it's variable. But maybe we have 1 or 2 years until the growth will stop.
Yeah, because you said many times over the years that basically after all the studies have shown after 16, there's growth hormone's not really going to do anything.
Exactly.
And so the younger it's identified that your child is not growing to expectations, the better.
Exactly. It's supposed the pediatricians, they said that if you see that your child is not growing, but he's younger than 4 years, you keep watch it. And we call this 4 years like the catch-up period. They have to try, in this period, all the child, they have to catch up to the rest. Mm-hmm. They have to reach the curve of growing to the like the other population.
So typically, how is it that parents identify this? I mean, they have their child, and he or she is basically shorter than her classmates at the same age, and then it becomes like, okay, and then what is it that they do at that point? Then they're supposed to go to they probably go to their general practitioner, and then he's like, okay, maybe you need to go see a pediatric endocrinologist.
Exactly, or just your pediatrician. He will notice if they do the growth chart, and if they see that he is under the 50th percentile of the other population, that is one red flag that we should be aware. Or also, if you see that your child for 1 year is not growing, I mean, if you measure at your home, if you're doing a scale and you see that he's not growing for 1 year, or that you haven't changed the size of her shoes or the clothes in 1 year, that is something that shouldn't happen.
Okay, and that's a signal that there's an issue and it needs to be taken seriously.
Exactly.
And not waiting and praying that something's going to...
Exactly. What is very important, and I always try to advise to all the patients and the parents, is you shouldn't wait until he's a teenage, okay?
Right.
You should be aware that the best time will be before they are 9 or they are 8.
Right.
Because we have time to find out whatever is the reason and to treat it. In most of the children, everything is treatable. Mm-hmm. And even if they are healthy and they produce good growth hormone, but if they are too short, they respond fine if we give them also an extra growth hormone.
An extra boost.
An extra boost.
Yeah, because there's a set of, every kid needs to do the blood work, and then what they need is an X-ray of their left hand.
Exactly.
Right, and the blood work, and the blood work, what you're looking for is to see if there's anything that's a red flag. It's like, hey, this is not right, because then that needs to be addressed first. Like we've had some kids come in, they had anemia.
Exactly.
And that way, with anemia, it was like, okay, we're not going to give you growth hormone, right, until the anemia is treated. And then once that's treated, then we can go forward with the growth hormone. But typically, most of the kids that we've seen, that everything has been normal in their blood, and that is basically the definition of idiopathic short stature, right? Like everything's normal, they're just not growing to their expectation, right?
Exactly. There's no an explanation of the short stature. That will be the definition of idiopathic short stature, which is the number one reason of short stature in the world, for no reason.
There's just no reason.
There's no reason.
That's the number one reason,
Exactly.
is there is no reason.
Exactly.
Okay, gotcha. There's no identified medical reason as to why your kid has short stature, other than they're just shorter than they should be, and they can be, and then this comes into how are you identifying how tall they actually should be?
Well,
like what is their growth? How are you determining their growth expectation?
Well, first, we measure according to the CDC growth chart. There are growth charts for the population. We know how big and how short should be the population, okay?
Right.
And it's supposed that we should be among some of that number. But we should be
So you're
like
taking
about
the-
the
so just-
50% of the size of the population. That will be the
So you're looking at the general population chart and growth heights in depending on your age and category
exactly of
and
your
blah, blah, blah.
age or your gender and the population where you live. And then the other thing that we take like a predictor is the size of the parents. Okay, there are some formulations. I don't know. Yes, then
Right. There's a formula.
yeah, there's a formula to measure to predict what should be the minimum for a girl or for a boy according to the parents' height.
Okay.
And also we consider in the interrogatory to the parents, it's very important to know at what age the parents start puberty. That's also very important.
What age do parents start at puberty?
Yeah, because there's also one condition related to idiopathic short stature that is the name will be constitutional delay of growing.
Constitutional delay of growth.
That is just that they are delayed.
And some kids are late bloomers.
Exactly.
Right.
And when we talk with the parents, they tell us, yeah, I started puberty when I was 16, and
then bam. Yeah, because I remember growing up in high school. You know, I remember specifically one kid is Kevin Cavanaugh. I was in San Diego, and we were playing basketball, and he was kind of like lanky, and he was a couple years younger than me, and he was my height, whatever. His dad was real tall, and he had like 8 brothers or something. And anyway, so I remember then I went to Montana, and I came back, and the kid was 6'10". He later on went on to play basketball internationally, whatever. And then, but yeah, it was just like he literally grew 6 inches in like a year at 15 or 16, and it was like wow. And so yeah, and I guess that's a late bloomer.
yeah.
So they're coming here. They can see a really good endocrinologist. You do the growth charts, right? I mean, and so you look at the X-ray. The X-ray basically the X-ray can be sent in the PDF form, and it's really obvious if the growth plates are open or not. And so this is the first step, and the second step is to get a series of blood tests.
Yeah, and also because what is important about the X-ray is the first thing is to see if the growth plate is open, and also to see the bone age, because when we are growing, our bones usually are younger than our chronological age. If they are much, I mean, if our bones are 9 years and we are 9 years old, that tells us that the high should be indeed the same that for 9 years. Okay.
The what?
So the high. But if the bone age tells us that he's 7, then we should think that at 7, what was the high? Okay. So we consider that the high should be smaller in that children, in that moment.
Right. So some kids are coming in, say they're 14 years old, but when you look at their X-ray of their left hand, and you look at the growth plates, you're saying that like sometimes, well, they're actual from that you can identify. It's like, listen, that's the bone age of a 12-year-old. So you're 14, but your bone age is 12, and actually that's a good thing because if you had a bone age of a 16-year-old and you're 14, that would probably mean your growth plates are closed and it's game over. And unfortunately, we've had some clients that come in and their growth plates were closed at 15.
Yeah.
And it's like there's nothing you can do. You can't reopen them. So what can we do at that point when the growth plates are open? and all the blood tests do check out. At this point, you usually recommend something like puberty blockers.
Yeah, but, well, the problem is, the thing is, if they are this age, but like you say, if they still open, the studies says that in this, especially in men, in girls, it's very uncommon that they have open growth plates at that age. Okay?
And usually, so with the girls, it's usually, when is it pretty much done for girls?
1 year after they have the first period. It's done.
1 year after the first period. So if you're going to want to take growth hormone for your daughter, you need to catch it early. You need to catch it early.
Yeah, we can stop the puberty in girls. We can stop puberty within the first year that they start their period. After that,
you can stop puberty.
We can.
So you can.
Yes,
and
we
so this
can.
is what we're talking about now is taking puberty blockers. I mean, I know that's been extremely controversial with all this stuff, but this is actually for a real medical purpose, actually to help your kids grow taller.
Exactly.
You're pausing the puberty, combined with HGH, you get better results.
Exactly.
And why is that?
Why? Because in one way we block there are two ways to block the puberty. One that is that we use the most is using a medication that block the receptor of the testosterone. So the child is going to still producing the testosterone, but the testosterone has no place to go and work. So in that way, what we're going to do...
So they're producing testosterone, but it's just blocking it from being the receptor.
Yeah.
Because some people, there's a lot of, there's a lot of search traffic. People are like, does testosterone help my kid grow taller? And it's like, no, it does the opposite.
Yeah. Mm-hmm. I mean, it is going to in one moment.
It will, like when puberty stops, right?
Yeah, but when we're trying to use growth hormone, we have to stop the testosterone because together, I mean, in that moment, that moment when they are in this last opportunity of using growth hormone, and what
the growth, so the puberty blockers essentially pause the growth plates from closing.
Exactly. That's why. That's what we need.
That's the only reason you recommend
That's
it.
what we need.
So you're buying more time, basically, by pausing the growth plates from closing. And from what I've read on PubMed and the other medical sites is that just even without taking growth hormone, just by pausing the growth plates from closing, will actually you're going to allow your kid more opportunity to grow taller, and in fact, that does happen. And then when you add the puberty blocker, the growth hormone on top of that, it's like a 1-2 combo.
Exactly. And also the good thing is that once that we have used the growth hormone and we said, okay, it's time to stop it, and then we stop the puberty blocker, now he's going to have like this and this trigger of testosterone, and is going to have another spur of growth. When we stop the puberty blocker.
So when you stop the puberty blocker, puberty kicks back in. Yeah. And then when it kicks back in, it's like a bam, then you get another jump in height.
Yeah.
And okay, yeah. One of our clients, he had a huge growth spurt.
Yeah.
After that happened, and you told him it was going to happen, and it was like it happened.
Yeah.
So yeah, they're coming back pretty soon.
Yeah, and he's one of our best experience of success because
he's 5'10" now. This was about 3 weeks ago.
Because we met him when he was 9.
Right.
That's why we had that success with him.
Yeah, because he came in so early. Mm-hmm. Yeah. So always the question is, this is always because everybody, they're coming in, they're like, what do I expect? What is it? How much is my kid gonna grow? what's the expectation? And you came back with some of the best answers for this because obviously and you have a ton of experience. It was what is the expectation? This minimum height expectation, like 1 inch, 2 inches, is not happening within a certain period of time. Then it's just
then
it's not working.
Exactly. So the minimum should be that in 6 months, at least 3 centimeters.
At least 3 centimeters.
If in the first 6 months that is not happening, then maybe it's not going to work.
What is that, an inch and a half?
Yeah.
About an inch and a half.
Yeah.
So about an inch and a half. So if you're not getting an inch and a half in the first 6 months, then using growth hormone, then it's just that, okay, then you tried, you did everything you could, but there's no sense going forward.
Yeah.
So you basically, every child that tries taking growth hormone needs to try it for 6 months, and you're looking for at least 6 months, and you're looking for an inch and a half in that first 6 months as basically a marker of success.
Exactly. And then there are another signs that we can predict then also how tall is going to be, because when we are doing the measurements at the office, you've seen me, when I measure the arm span, in some point when we are growing, we are not symmetrical. We have longer arms than the legs. That's why we look funny.
So that's why they got that awkward teen years.
Exactly. So this is a predictor of how tall are we going to get in the next few months.
So the distance between the two.
Yeah. So maybe, for example, sometimes I measure somebody and maybe he's 157 centimeters, the arm span, but he's just 150. So that means that maybe in the next 6 months, he's going to be 157.
So the distance between when you hold your arms out here, what is that a predictor of? Your height?
Yeah. When you are growing.
So if I'm 6 feet tall, my reach is going to be 6 feet?
Yeah. In some moment of your development, it's going to happen. I mean, this is not a rule.
Oh, it's not a rule.
For when you are an adult.
Okay.
This is when you are growing.
So if your reach is taller than your actual height at a certain point, it only makes sense that your actual height is going to at least match your reach.
Mm-hmm. Because your body is going to try to match. I mean, it's going to try to get symmetrical again.
What was I looking? There's a STEM test that they do.
Okay.
Like in the States, you don't do it because I think you told me that the STEM test is only required when the IGF-1, which is used to measure the growth hormone, is too low, and that's the only reason. But in the States, I think they require every kid to get these tests, and I think that STEM test is I don't know, it's ridiculously long, kind of like agonizing thing they put these kids through. They make it very difficult for everybody to get insurance.
Yeah.
And in Mexico, it's just not the same. It's not like that. I mean, you don't. It's just like you come in, you identify an issue. It's like you can give the kids growth hormone. It's not a problem.
Exactly. Yeah, and we make the stimulation test just in those cases when we have an IGF-1 too low. I mean, when it's lower than the expectations, the reason to look for to make the stimulation test is to know if he has deficiency. Because when somebody has deficiency of growth hormone, like a child, okay, he's going to receive growth hormone now, but also like an adult. He needs growth hormone always.
Right. So,
that's the difference.
And that's a problem. That's usually an issue with their pituitary gland or something.
Exactly. And then we have to look what is happening with the pituitary.
And so there's another condition. There's another issue.
Exactly.
Yeah. I mean, so what's the best result you've seen? With kids, with a boy, with a girl?
With boys.
With the boys?
Yeah, it's the best.
Why do you think that is? I mean, the girl starting early enough, or
no? Well, I think that because culturally they are always looking that we should be taller.
The boys,
yeah. And then so the parents, they are always more aware of the height in boys. I think that is that, because if you see, we don't have that many girls to clients.
We've only had not many. We've had a few. Yeah. It's mostly boys, exactly. So what's the best result you've seen in boys?
Well, I cannot recall a number of high. I mean, of high of growth, but I think 8 centimeters. I think
8 centimeters,
our
and
client from Texas, I think that the last time he reached 8 centimeters in just that period.
in the first 6 months.
No, not in the first six, in the second six.
In the second
But
6.
since the first 6 months, he had a good response.
There's a reason why that you tell people there's a certain growth expectation in the first 6 months, not the first 3 months. Because some you say sometimes, well, there's no result in the first 3 months.
Exactly.
And I've gotten phone calls, they're like, well, it's not working. It's like, just hang on.
Exactly.
Hang on. You got, and then is there a reason that you know of?
No, there's no specific reason. I mean, in all the studies, in all the research studies, they noticed that in the first month you could see, but even if you see growing, it's supposed that it's not the medication that is growing. If you see the growth in the first 1 month, 2 months, it was
It's a natural.
natural growth. Okay, the medications, you're gonna see it always after the 3 months, and it happens with all kind of hormones. Okay, like when we're treating somebody from thyroid diseases, when we're giving somebody testosterone, it's the same, because what the hormones do in the body is they trigger to produce the DNA work to produce more components of the cells, more tissue, and more things. So that takes a lot for the body. Okay,
It takes time.
It takes time.
It takes time. It doesn't just you just don't inject it. And next thing you know, you're like,
exactly.
So there's a lot of adults using it, and so I mean, I use it. The biggest benefits for me that I've noticed is I recover faster. I have more energy. Obviously, you get more. You get results from when you're working out. So, I mean, what's your thoughts on what's your experience with adults? Because this, all this stuff is banned in professional sports. I mean, they won't. A couple years ago, they even banned it in golf. I mean, football, basketball, baseball, everything.
Yeah, I mean, in sports, that's another subject that, indeed.
We had a professional baseball player that wanted to come down and you were like, no.
Yeah, no. That's
you were like, no.
That's cheating.
Yeah.
No. Yeah, but I mean, speaking about what makes in your body, or why do we need growth hormone? Because we are still producing growth hormone when we are already adults, okay? But what are the functions of the growth hormone? Helps with the metabolism, okay? Helps you to metabolize the fat when we're already adults, to metabolize better the sugar also, to have more energy, like you said, to still producing good collagen or for the skin, to the muscles to recover better. Like you said, and that is something a little controversial, what happens with the sports, like you said, that you've seen results when you work out, is because you have more energy, okay?
Right.
But it's not the growth hormone that is making you bigger. It's just that you have more energy, okay? It's not.
Oh, so really, so the growth hormone is helping you with more energy, and then you're working out more consistently, and you recover. But it doesn't help. It helps with recovery.
Yeah,
no?
exactly. You recover better, but you're not getting bigger because the growth hormone. It's because you have more energy.
Yeah, and that's what I kind of like. It's like you take the growth hormone, and then you're sleeping better. You're recovering faster.
And you metabolize better what you eat.
So your food's being metabolized better, and so what does that make you do? Well, it makes you fresher when you wake up, and then you're going to want to work out again.
Also makes you leaner. Okay, that is an effect. Even if you don't work out, that is going to help you. It makes you leaner. And also, like your sleep pattern gets better, your cortisol levels are better also, because that's also a problem now with this lifestyle that we have. we are always stressed, so we have always the cortisol so high, and that's one of the reasons why we have so many diabetes, so many heart conditions. So we are getting fat so easy than before. I mean, it's not just what we eat; it's the way that
It's
we
the stress levels
the stress
and the way
levels.
we're eating. And you're so the best. When is the best time to take the growth hormone?
The best time, I think, that will be at night, because what in endocrinology, what we try to do all the time is try to mimic what the body does, and we produce more growth hormone while we are sleeping.
Growth hormone is produced in your sleep when you're in REM sleep, right? And then that happens when about 3 hours after you get into falling asleep.
Yeah.
And the growth hormone, when you inject it, takes about how long to kick in?
Well, like 1.5 hours, something like that.
So the ideal time to take it is what, like an hour and a half before you go to bed?
Yeah, or some half hour before you go to
Right.
bed.
I take it in the morning or when I remember. But and it seems to work fine.
Yeah,
but
and
I
it
mean,
works.
but I would everybody always asks that question: when should I take it? And it's like I always just kind of say, well,
Yeah.
Roberto always says take it an hour before you go to sleep, and so that's the best. Okay, so you got the rich pianas. You have these people that are just doing obscene amounts of HGH. I mean, we all know the bodybuilders have been doing lots. When we're talking about the dosage, how are you coming up with a dosage for an adult? I mean, we typically say 2 IUs. 2 IUs, was it 0.33 milligrams is 1 IU, so about 0.65, 0.7 milligrams.
Yeah.
I mean, but how you come with? Is there a specific way you come up with a dosage for an adult?
Okay. The dosage are already described that it should be in adults. We should start at least with 0.5 units, and we should go between 0.5 to 1.5 according to a specific patient. That is what is studied for patients of lacking growth hormone. Okay. But in people that is not lacking with most of the hormones, usually we need the double. It's like with when we talk about dosage with children. When they produce growth hormone, they actually need more than those children that they don't produce, because what we're trying is to give an extra boost. So if we want to have the anabolic effect of any hormone, we need to give the double of what you produce, of what the normal people needs. So in that case, the normal, for most of the population, the dosage will be one unit. But in these cases that we are talking about adults, that they produce it but they don't feel fine, or their IGF-1 it's fine but in the lower range,
Right.
because they have other health issues, they need at least the double. So that will be at least 2 units.
And so what they're always trying to do is they're trying to get their hormone levels to the upper end of the natural range.
Yeah.
Is that right?
Yeah. And what the recommendation will be, or what we look is trying to check in these cases, or the IGF-1 or talking about the testosterone, that they get to a higher level, but trying always to keep them within the range, not to be outside the range, because within the time it's more likely to have the other effects of the hormone. For example, with growth hormone, like you said, when we see people that is using this bigger amount of growth hormone, then you can develop changes on your bones, maybe the face or the bones of the arms, okay? Because they are going to try to grow.
Right. So it also causes your organs to grow.
Yeah, exactly.
And that's because so it's not a mystery why somebody like that guy, Rich Piana's heart exploded. It was like sad. Anyway. So dosages for children.
The dosage, always we calculate the dosage according to the weight in kilograms. So in children with idiopathic short stature will be 0.035 milligrams per kilo.
Okay.
Okay?
Yeah. And there's a specific calculation. Is there anything? There's a specific calculation when determining a dose for a child based on their weight. Now, is there anything else? Any other factors that you might because it does vary sometimes.
Yeah. Also, the metabolic condition of the child. If the child has problems with the weight, if he's overweight, or if he has some sugar problems, we try to go to a lower dosage, because one of the things that we look on the blood work is to see how is the sugar, because growth hormone in everybody, okay, in us also, can trigger to increase the sugar. So we have to be careful that they don't.
That's why you always check for diabetes and stuff.
For diabetes or pre-diabetes. Because we have to be careful with that. And also because that will be another reason because of the growth to be not the success.
If there's diabetic.
Yeah.
Okay. So people are like, does each growth hormone cause cancer?
Yeah. Nope.
No, it doesn't.
No.
And we actually had a guy come in from Canada that was in the field, and well, he said this. I mean, he was like, I prescribe it to my cancer patients.
I mean, if there's no signs of cancer anymore, you could use it.
Right.
Okay. But what that means that you've been at least 5 years cancer free.
Okay.
Okay. Because in other way, I mean, growth hormone doesn't produce cancer, but stimulate all your cells of the body to growth. So if you had cancer and there's some cells there sleeping, they could grow.
And so that's just something you want to stay away from.
Yeah, exactly.
Yeah.
But
it's not worth it's a big risk. That's unnecessary.
Yeah, in those cases. But in general population, no. There are, I sent it to you, I think a few years ago, like 2 years ago. They publish in the US in a medical magazine, the research they made this review through the years, all the children that they received for the last 40 years growth hormone, to see what happened. How many of them developed cancer in the adulthood, to see if it was different to the other population. And they showed that no, there's no difference if you were treated with growth hormone when you were a child, that you didn't have more risk of develop cancer or any other thing, like comparing you with the other population.
Okay.
So it's really safe.
What are your most popular? What are the most common questions that you get?
Well, I think that one that is very controversial, not with the growth hormone, with the puberty blockers. Because a lot of parents are very concerned because they go online and they look for the medication and they see that it's also used to treat prostate cancer. Okay, and sometimes they are really scared.
The anastrozole.
Anastrozole.
Yeah.
Okay. And no, it is not chemotherapy. Okay. The reason what we give it also in people that had prostate cancer is because the prostate can enlarge because of the testosterone. So what we're doing in those patients is blocking again the testosterone to have a place to work.
For what to work?
To go and stimulate the prostate.
Okay, gotcha.
So, but it's very important because a lot of parents, they think that we are giving to their children something that is for cancer. And no, it's not for cancer. Okay? And anastrozole.
And so it's used for the same purpose. I mean, it does the same thing. You're blocking
the testosterone.
Exactly. And that's it.
Yeah.
And so that's with kids, or especially young boys, for them to take that, they're still gonna produce the testosterone. It's just gonna block it from actually having any effect.
Yeah. And I always say, like I said to a lot of patients, and there are a lot of things in medicine that we use it for a lot of diseases. I mean, it's not that one medication is just for one disease. Once that we stop growth hormone, nothing. Your body is going to start producing normally again, and is going to continue the normal process. Okay. Sometimes, especially men, it's supposed that we could grow naturally again a little bit around 18, the 18 years.
A little
Okay?
bit.
A little bit. Maybe insignificantly, maybe we wouldn't see it. That depends. So maybe they're going to see it again. And when we stop the puberty blockers, after around, depend on what we use. If we use an astrosol, puberty will start again within 1 month after we stop it. Okay?
Right. And
Very
typically, how
easy.
do you determine when you're going to stop that?
Usually, when we see that the effect of growth hormone is not working anymore, okay, or when we reach already the stature that we wanted,
And then
then we say, okay, we're gonna stop. He's already on the place where he should be, or where she should be.
Okay. So basically, you're looking at the growth chart, and you're like, okay, he's starting to jump to the percentile he should be in, and then at that point, because you did that with Kit too, I think, because he stopped, and then he said, okay, because I remember seeing a chart. He had jumped up one or two. I don't want to say standard deviations, but he jumped up one or two, whatever, and
Yeah.
he was more at the level of height where he should be for his age. And then, like you just answered that, and I stopped taking the growth hormone.
In case, for example, in case of adults, when they want to stop it, what I will recommend is to titrate the dosage. I mean, if you were using 2 units, then go to 1.5, then go to 1, and then 0.5 for a period, and then stop it.
Because the reason why people always ask this is because everybody always relates this type of stuff with bodybuilding and testosterone, and these stories of these bodybuilders where their levels of a testosterone, they just don't produce testosterone anymore, and they don't do it anymore for the rest of their lives. Is that true or not?
In some patients, depending because bodybuilders usually they use these huge amounts.
Yeah.
Like I don't know, 6 times of what we normally.
So, what's the highest
produce.
level of testosterone you ever seen coming in? I don't know if you ever work with bodybuilders.
I mean, no,
You don't.
that I've asked what they use. I don't know.
Like on a blood test. I mean, typically,
Oh no, in the blood test, I mean, unmeasurable. Sometimes you cannot even measure it. But when they told me the dosage, I mean, sometimes they use 1 injection daily, and it's supposed that
one
should
injection
be
daily. That should be like once a week or once every 2 weeks.
Yeah, or once every 2 weeks.
Yeah, and they're doing it once. They're doing it's obscene. Yeah. So, how often do you recommend getting blood work done?
I recommend generally at least every 6 months. Specifically, and like I said, for people that using testosterone, that is more popular. If you decided to use it, it's fine, but keep a track on your health. Okay, go to a professional that guides you. Not on the dosage. I mean, if you decided to use it, it's fine. But to be sure that you're not having side effects, because most of the times when we give you an appointment to like a follow-up appointment and any patient is to be sure that you're not having trouble for anything that you're using. I mean, talking about any disease. Okay.
Right.
Okay. So if you're using, keep a track on your health, and I recommend every 6 months because you have to check how is your cholesterol, how are your red cells, how is your prostate. That's the most important, because every man we are going to have enlargement prostate. Everybody's
going to have an enlarged prostate.
Okay, after 40 years, every year we should have a prostate test. Okay, because it's the normal process of growing. The prostate is going to be enlarged. But if we are using extra testosterone, then we have more chances of that to happen.
And this is why we work with him, because he knows what the red flags are. When you talk about the growth hormones and the different brands of growth hormones, available on the market, there used to be, there was Norditropin and Humatrope, and they both got discontinued in Mexico. Okay, and then now there's genotropin, Cyzan, and Omnitrope. And which is the best is the question I always get.
I could tell you the ones that I have experience using it. Okay, I have experience with Omnitrope, Cyzan, and Genotropin. That's what I've been using. The other ones I never use it because was not so easy to get them. I can tell you the worst that you didn't mention, but it's a good thing that you didn't mention. But there's one that I don't even think that there's a quality enough there because you don't see a result there.
And that's Serendip.
Yeah.
Yeah, I remember you mentioned that to me a while back. You said it clinically in the trials in Mexico when they were using it on children that the results were mixed. There wasn't really the results compared to the other growth hormone. This is the comments that you mentioned. And so, yeah.
So I don't like that. And, but for the others, I mean, the difference rely more not in the effectiveness. What the laboratory's been working on, like Cyzan or Omnitrope, will be on the devices to give you the shot. Okay, because like we're talking about most of the market for them is children, so they try to make devices that they don't hurt that much and
easy to use.
And that they don't get nervous when they see the needle, or that they give the exact amount and that it's easier to apply to inject.
So I really appreciate you coming in. Well, this is Damian Campbell from HGH Vallarta, signing off.
Thank you. This is Roberto Gutierrez, endocrinologist here in Vallarta.
Thanks. Appreciate it. Excellent.